I'm Shanna Burchell. I am the Equipment Manager for Health Promotion Specialist, and we are donating the use of our equipment for the Mission 2011 event. This is our DentalWorks ProSeal 2, and this unit was originally designed strictly for hygiene. We have kind of done some revamping and been told that we should be able to provide some restorative work for the event. So we're going to go through the unit. This is the low-speed motor. We have been assured, however, that it has enough power to operate the high-speed attachment. This is our piezo scaler, air-water syringe, low-volume suction, and high-volume suction. This is the water bottle, and we'll go ahead and cut the unit on and let it build up pressure. We're going to go through this just kind of individually at a time, one at a time. Like I said, this is the low-speed motor. This is the high-speed attachment. We do not have water capabilities for our motor attachments, so the tooth will have to be manually cooled with the air-water syringe. This is your foot control, and we'll just go ahead and press. Now this handpiece, there is a knob up here, a switch, that can be to change the direction of the handpiece attachment. This is the piezo scaler. This can actually be controlled, the vibration can be controlled with this knob, and the water flow with this knob. Your air-water syringe, water, air, and of course to press to for your mist. Your low-volume suction. Now you will need to make sure that the low-volume suction is completely cut off to operate the high-volume suction at full capacity. Now, of course, our units are run with distilled water only. This is your fill line. You can go a little above that line, but it is not recommended to fill the bottle completely up. Of course, you will lose pressure. Now, our suction container is in the bottom case. I'm going to go ahead and open that up for you now. We recommend that you check the suction container each time you have to fill the water bottle up. You may be able to see a couple of patients before you need the waste container needs to be emptied. It does have an automatic shut off, so when it is full, you will lose the suction in the unit. The red, we have labeled these with red, and it will need to be lined up with this connector with the red ring. That's pretty important, so make sure that's done. Between each patient, you'll need to make sure that you run the enzyme cleaner through the suction lines, and in order to do that, you will need to, after you have run that off, you will run that through, you will cut the unit off. You will need to make sure that you disconnect this quick silver disconnect on the side. Press on the case to release the pressure. Hook back up. Unscrew your water bottle. You can then fill back up with your distilled water. Screw back in. Make sure that is lined up properly. You can strip the threads of the water bottle. And standard hygiene practices will need to be used in wiping down the unit. Of course, the high-speed motor attachment is autoclavable. The tips for the piezo, and these are disposable air water syringes. And we will have 20 of our hygienists there for the event on Friday, and we can kind of pass on the knowledge as far as the units are concerned, and we will be there to answer any of your questions. Thank you.